Welcome to CPT Coding Guidelines Review, Skin Replacement Surgery. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding skin replacement surgeries. So, before we dive into the guidelines themselves, let's take a quick look at what skin replacement surgery is. Skin replacement surgery is also known as skin graft surgery. These procedures use healthy skin from another area of the body or a synthetic graft to repair or replace damaged or injured skin by providing protection and support during healing. Grafts do not carry their own blood supply. They rely on blood vessels in the wound bed to grow into the graft and perpetuate healing. Grafts are used to treat burns or wounds that cannot be closed with stitches. The type of graft used depends on the condition and size of the area to be treated. Types of skin grafts include autografts, such as split or full thickness skin grafts, skin cell suspension grafts, and composite grafts, and grafts made of artificial or synthetic skin. If you're interested in learning more about skin replacement surgeries, please visit the websites at the URLs shown here. Skin replacement surgery primarily includes two reportable components: surgical preparation of the wound site, and topical placement of a graft. Types of skin replacements include autografts, such as split or full thickness skin grafts, tissue cultured autografts, and skin cell suspension autografts, and skin substitute grafts, such as homografts, allografts, and xenografts. Grafts are anchored using the provider's choice of fixation, and routine dressing supplies are included. For procedures involving the wrist and/or the ankle, use the codes with arms or leg in the code descriptor. When reporting codes that reference 100 square centimeters or 1% of body area of infants and children, the measurement of 100 square centimeters applies to children 10 and older, and the percentage of body surface area applies to infants and children younger than 10. These measurements apply to the size of the recipient area. Codes for skin substitute or autograft procedures from code range 15100 to 15278 are separately reportable when performed for definitive closure for another procedure, such as a radical mastectomy or deep tumor removal. Also separately reportable, in addition to the code for a primary procedure, are biological implants for soft tissue reinforcement and the supply of skin substitute grafts. Surgical preparation for skin replacement procedures is the initial service, related to preparing a clean and viable wound surface. During surgical preparation of the wound bed, appreciable non-viable tissue is removed or excised to treat a burn, traumatic wound, or necrotizing infection. A clean wound bed could also be created by incisional release of a scar contracture, resulting in a surface defect from separation of tissues. The intent of surgically preparing a wound is to heal the wound by primary intention or negative pressure wound therapy. Due to the patient's condition, skin replacement procedures may need to be delayed, but the intent is always to include these treatments to heal the wound. Surgical preparation does not include removal of non-viable tissue or debris from chronic wounds left to heal by secondary intention. Note that the codes for surgical preparation may also be used in conjunction with codes for tissue transfer and complex repair procedures, as well as with codes for skin replacement procedures. Codes 15002 to 15005 report surgical preparation of the recipient site for skin replacement procedures. These codes are assigned based on location and size of the defect. When selecting codes, sum the surface area of all wounds from all anatomic sites grouped together into the same code descriptor, such as the area of wounds of the trunk and arms. Conversely, measurements from different groupings of anatomic sites, such as the face and arms, should not be summed to determine the size of the recipient area. Codes 15002 and 15004 report surgical preparation of the first 100 square centimeters of recipient site for skin replacement procedures. For example, preparation of 20 square centimeters of surface area of the right hand and 15 square centimeters of the left foot total 35 square centimeters of surgical preparation of the hand and feet, which is reported with code 15004. Codes 15003 and 15005 are used to report each additional 100 square centimeters of site preparation. For example, if 75 square centimeters of area is surgically prepared on both the right and left thigh, code 15002 would be assigned to report the first 100 square centimeters, and add-on code 15003 would be assigned to report the remaining 50 square centimeters. Modifier 59 is used with codes 15002 and 15004 to indicate a distinct procedural service when more than one code needs to be reported for the same date of service. Codes 15011 to 15018 are used to report skin cell suspension autograft procedures. These procedures use a spray-on application of a skin cell suspension created from skin cells harvested from the patient to treat thermal burns, traumatic avulsions such as degloving injuries, surgical excisions of skin such as those to treat necrotizing infections, and a resection of skin for diagnoses like skin cancer. Certain procedures are separately reportable with skin cell suspension autograft. These include surgical preparation of the recipient site, separate autografts such as split or full thickness grafts performed prior to the skin cell suspension autograft, and repair of the donor site requiring skin graft or local flaps. Codes 15011 and 15012 report harvesting of epidermal and dermal skin for creation of skin cell suspension autografts, and the skin may be divided into smaller portions for processing. The expansion ratio of harvested skin to autograft is 1 to 80. For example, 25 square centimeters of harvested skin yields enough graft material to cover a defect measuring up to 2,000 square centimeters. Codes 15013 and 15014 report preparation of the suspension autograft product. This process requires enzymatic processing, manual mechanical disaggregation of skin cells, and filtration of the final suspension. It is not appropriate to assign codes 15013 or 15014 for skin that is non-manually or automatically processed. Application of the skin cell suspension autograft is reported with codes 15015 to 15018. These codes include application to both the wound and the donor site when performed. Application of a primary dressing with choice of fixation is included in these codes. Autografts or tissue cultured autografts other than skin cell suspension grafts include harvest and/or application of an autologous skin graft. Removal of a current graft and/or simple cleansing of the wound are also included when performed. Procedures that are separately reportable in addition to autografts are repair of the donor site requiring skin graft or local flaps and debridement under certain circumstances, to include gross contamination that requires prolonged cleansing, removal of appreciable amounts of devitalized or contaminated tissue, and/or debridement carried out independently without performance of primary closure. When coding for the application of autografts, including tissue-cultured autografts other than skin cell suspension autografts, select the appropriate code from the range of 15040 to 15261. Codes are assigned based on the type of graft and the location and size of the defect. Measurements used for selecting codes apply to the size of the recipient area. To determine the correct measurements for multiple wounds, sum the surface area of all wounds from all anatomic sites grouped together into the same code descriptor, such as the trunk and arms, but do not sum wounds from different groupings of anatomic sites, such as the face and arms. Skin substitute grafts include several types of grafts, such as non-autologous human skin, dermal or epidermal, cellular or acellular, non-human skin substitutes such as xenografts, and biological products that form a shear scaffolding for skin growth. The codes used to report skin substitute grafts are not used to report application of non-graft wound dressings in various forms, such as gel, powder, ointment, foam, or liquid. Injected skin substitutes are also not reported as skin substitute grafts. Procedural elements included in the application of skin substitute grafts include application of non-graft wound dressing and removal of a current graft and simple cleansing of the wound when performed. As with autografts, debridement is separately reportable when gross contamination requires prolonged cleansing, removal of appreciable amounts of devitalized or contaminated tissue are performed, and/or debridement is carried out independently without performance of primary closure. When coding for the application of skin substitute grafts, select the appropriate code from the range of 15271 to 15278. Codes are assigned based on the location and size of the defect. To determine the correct measurements for multiple wounds, sum the surface area of all wounds from all anatomic sites grouped together into the same code descriptor, such as the trunk and arms, but do not sum wounds from different groupings of anatomic sites, such as the face and arms. The supply of skin substitute grafts should be reported separately in conjunction with the code for application of the graft. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com. Happy coding!